One of those trials that's recently reported in breast cancer is called the AMELI trial, and it is taking a look at a class of drugs we call CDK4/6 inhibitors. These are drugs that are commonly used in treating hormone receptor positive breast cancer, and they're also drugs that in practice we're frequently reducing the dose because of side effects, things like a low white count or fatigue or things like that. So the AMELI trial took a look at one of these CDK4/6 inhibitors, a drug called ribociclib, and it compared two different doses: the full FDA-approved dose, 600 milligrams for 2 weeks on 1 week off, versus 400 milligrams. And the way the trial was designed, it wasn't a big trial. It had less than 400 patients. And it was what we call it, a non-inferiority trial. It was looking to see if the 400 milligram dose was not inferior to the 600 milligram dose. Now, we learned a lot of important things through this trial. The conclusion was that they couldn't definitively say that 400 milligrams was the same in terms of response rate as 600. It was close, but with all the statistics and the small-ish number of patients, they weren't able to show that. But it was close. And what they did show was that the amount of time that the tumor was under control was similar, and that the side effects were markedly reduced. So while the conclusion of that trial technically, statistically, was that they couldn't say that, yes, we've shown you absolutely you can start with 400 milligrams and not the full 600 milligrams, what it showed was unquestionably the side effects were less. And in the big scheme of things, even though it didn't meet statistics, it was very close in terms of the effect on the tumor. So that was an interesting and important trial. We also have an ongoing trial that we're running at ASCO, the American Society of Clinical Oncology, which is my society, and it's funded by the Patient-Centered Outcomes Research Institute. PCORI. We're calling it our CDK study. We're looking at both ribociclib, the one in the AMELI trial, and we're looking at palbociclib, one of the first cousins of ribociclib. And we're looking in the metastatic breast cancer setting, and we're looking at an older population, women 65 and older, because this was a group in all the trials that we've done of these drugs. And in real world evidence, these drugs have been approved for many years, so we know what's happening in practice. We know that especially in an older population, they're, one, being started at a lower dose. Two, if they're started at a high dose, they're frequently being dose reduced because of side effects. And three, sometimes patients aren't even having these drugs used at all because of the fear of side effects if we start at the high dose. So what we're looking at in this study is, it's an interesting design. It's different from the AMELI trial because we're not directly comparing two different doses. We're comparing a strategy of start at the FDA-approved dose of these two drugs. You get to pick which drug and what you're combining it with, but start at the FDA-approved dose, but then reduce the dose as it's not tolerated. Okay, that's what's commonly done in practice, versus a randomization to start at a low dose and then only escalate it, only increase the dose if it is tolerated. So we'll get to that steady state, the dose that the patient is able to tolerate sooner in this way. And we are hoping we won't have a lot of dropouts. And what we're looking at in the end is the time until these drugs, these CDK4/6 inhibitors, are discontinued, time to treatment discontinuation. So it's a very interesting concept. One is you start high and you reduce if not tolerated. The other is start low and you only increase if tolerated, because patients can be on these drugs for years and years and years. And we want to get to that dose that they're going to be able to tolerate sooner without causing a lot of side effects. So it's a very interesting trial design. It's ongoing, and we're really excited about a very unique trial design that is all about having maximum impact on the cancer and the minimum impact on the patient.